Welcome, everybody, to today's Health Policy Grand Rounds, hosted by the Philip R. Lee Institute for Health Policy Studies, or IHPS, at UCSF. My name is Rita Hamad. I'm an associate professor in the Department of Family and Community Medicine and a core faculty member at IHPS, and I'm delighted today to introduce Dr. Maya Rawson-Slater, our speaker. Dr. Rawson-Slater is an associate professor in the Department of Health Policy at Stanford University School of Medicine. She's also a research associate at the National Bureau of Economic Research and a research fellow at the Institute of Labor Economics. Her research lies at the intersection of health economics, public economics, and labor economics. And in particular, she focuses on issues in maternal and child well-being, family structure and behavior, and policies targeting disadvantaged populations in the US and other high-income countries. She's the recipient of the National Science Foundation Career Award, and she received her PhD in economics from Columbia University. And even though she's currently at Stanford, we won't hold that against her since she also got her bachelor's in economics and statistics at UC Berkeley. So she's originally a UC person. So as someone who dabbles in paid leave policy evaluations myself, I've been following Dr. Rawson-Slater's work for years, and she's written some of the seminal papers in this field. We're really lucky to have her speaking today at IHPS's Grand Rounds. Her talk is entitled Emerging Evidence on the Impacts of Paid Family Leave on Workers, Families, and Employers. So Dr. Rawson-Slater is going to be speaking today for about 45 minutes, and we'll save 10 minutes at the end for the question and answer session. Please make sure to use the Q&A feature of the webinar to put your questions in, and we'll get to them at the end. So you should be able to find that Q&A button hopefully at the bottom of your Zoom screen. I think Dr. Rawson-Slater, we're ready for you to share your slides and take it away.
Okay, thank you so much. Thank you for the wonderful introduction. And I'm really pleased to be here virtually with you all. So let me go ahead and share my slides. Okay, great. Hopefully everybody can see that. So as Dr. Hamad mentioned, I'll be speaking today about the evidence on the impacts of paid family leave on workers, families, and employer. This is going to be an overview of the huge literature on this big and important and policy relevant topic. I'll highlight a few studies by myself and my collaborators and some others that are, I think particularly yield some interesting findings. And I will also just preview a little bit of my own ongoing work on this topic. And I'll end with some discussion about suggestions for future research, which I think is going to hopefully help potentially move the needle on providing evidence on paid leave. So I probably don't need to motivate this too much, especially for an audience that's interested in paid family leave. But it's worth pointing out that the vast majority of Americans have to juggle work and family responsibilities in some way, right? So in the most recent pre-COVID year, 2019, about 72% of mothers, 93.5% of fathers with children under 18 were in the labor force. When we look at mothers of very young children under 3, the labor force participation rate is still more than 50%, right? So about 64. For fathers, labor force participation rates are actually similar regardless of how young the child is. And then moreover, there's plenty of children that live with only one parent. Most commonly, it's going to be a mother. And so here, this is not an option. Work is most likely a necessity for many of these women, mostly, and therefore work-family balance is sort of a really, really topical and important issue. So one of the biggest policy solutions to this challenge is paid family leave, right? So it's a policy that typically provides workers with some time off work. I'll go through more details in a little bit, right? But with partial wage replacement, and it's given to care for newborn or newly adopted children, as well as severely ill family members. So you've probably seen the statistics. The United States is one of 2 countries in the world without a national paid maternity leave policy. And it's really one of a few high-income countries without paid paternity leave either. Now, paid caregiving leave, so this is leave to care for an ill family member that's not a newborn child, is less common in other countries. And that being said, though, US still doesn't provide that.
Okay, well, that gets us into the grand rounds, but this is the only thing that I have.
So you want to
Oh, okay, great. And then paid family and medical leave sort of the newest, a lot of the most recent states that have passed this policy have included actually medical leave as well within the same policy. So this is leave that one can take for an own temporary illness or disability. Again, also less common around the world, but again, the US doesn't provide that at a federal level either. So what does the US provide? So we have what's called the Family Medical Leave Act, the FMLA. It's existed in the United States since 1993, and it offers 12 weeks of unpaid family leave to eligible workers. It does provide job protection, meaning there's a provision in the policy that means that workers can return to the same or similar type of job after the leave. And you also get continued health insurance coverage if you have insurance through your employer. However, there's fairly stringent firm size and work history requirements for the FMLA. So for example, you have to work in a firm with at least 50 employees. So workers in smaller firms are excluded from the FMLA, which means that only about 60% of private sector workers are in fact eligible for the FMLA, and even more are, maybe eligible, but not able to afford to take fully unpaid time off. So this means that the vast majority of Americans, their leave access is at the discretion of their employers. So what do we know about that? So according to the most recent data from the National Compensation Survey from 2021, only 23% of civilian workers have access to paid family leave from their employers. Now, this might seem low, right? It's less than a quarter, but it's actually a substantial amount of growth from just 14% in 2016. So that's a remarkable amount of growth, but it's still fairly low. And moreover, it's very unequally distributed. So for example, if you look at the 10% of the highest wage earners in the US, about 40% of them have access to paid family leave through their employers, so still less than half, right, even amongst this really high income group. And then if you look at the lowest 10% of wage earners, only 7% of them have access to paid family leave. So the biggest sort of players in this policy landscape have recently been states. So first of all, the oldest policy related to paid family leave is temporary disability insurance, or the TDI system. So birthing parents, parents who undergo childbirth, are eligible for 6 to 8 weeks typically, with some exceptions for longer leaves, of partially paid leave through this system since the 1978 Pregnancy Discrimination Act. However, the TDI system only exists in 5 states in the United States. So that's going to be California, Hawaii, New Jersey, New York, and Rhode Island. And the wage replacement rate in some states is very, very low. So, even though it's paid, it's very much partially paid. And then, of course, states have introduced their own paid family leave programs. So California was very much the leader in this space, with its policy going into effect in 2004, followed by the various states listed on the slide here. There's been a lot of action in recent years. So for example, Oregon and Colorado have policies that have been passed by their legislatures, and they're set to go into effect in the next year or two. They vary tremendously in terms of various policy parameters. So for example, in terms of the length of the leave that is provided, anywhere between 4 and 16 weeks, whether or not there's job protection. So for example, California's policy does not actually offer job protection. You only are eligible for job protection if you're also eligible for the federal FMLA. And in terms of its financing, it's really a mixture of mostly employee and employer payroll taxes. And in some states, it's actually just employee payroll taxes. So California is one of those states where the program is entirely financed through employee payroll taxes. These programs have much wider eligibility than the FMLA. So for example, there's no firm size requirements. And in states that already have temporary disability insurance systems, the paid family leave policy is kind of layered on top of that. They're, for example, in California, they're administered by the same agency, the Employer Development EDD, the Employer Development Department. And so they have very similar policy parameters. In states that do not have TDI systems, most often the paid family leave policy is introduced together with medical leave. So it's essentially meant to provide leave for an own temporary illness or disability, as well as family leave. Okay. So what are we going to talk about today? So first, I think a first order question before we get into kind of impacts on various population level outcomes It's more to understand, like, are people actually using these policies? Are there any inequities in the use of these policies, and what might be the barriers to use of these policies? So I'll talk a little bit about what we know about that, mostly relying on evidence from California. And then we'll sort of do a whirlwind tour through the literature. We'll talk about the research on the impacts of paid leave on workers' labor market outcomes, on maternal and child health, and then employers. And then, as I mentioned earlier, I'll do a brief preview and a little bit of new research on the impacts of paid leave on families with health shock. Okay. So again, we're going to talk mostly about California today, and partially that's because California's policy is the oldest, and so there's just been a lot more research on California's policy than really any of the other states. Also, California is a nice big state, and there's access to some pretty decent data. So in a recent paper with Sarah Bana and Kelly Bedard, we used administrative data from the California Employment Development Department to understand, trends as well as inequalities in leave use in California. So we had access to the universe of paid family leave claims over a decade period, with a lot of information on like the exact date that it was filed, whether it's a claim to bond with a newborn child or caring for an ill family member, the employee's age and date of birth and gender. And we also know if it's a birthing parent, whether they also took an SDI claim. So in particular, this means that women in California are actually, if they give birth, parents in California that give birth, they're eligible to first use SDI and then use paid family leave on top of that to get a longer leave duration. And all of this is linked to quarterly earnings data over 2000 to 2014. So we have the universe of employees working for an employer that reports to the EDD, which is pretty much the near universe of employers in California. And so we know their earnings, and we know the industry of the employer. So here are just some, descriptive figures of what's been happening over time with both bonding and caregiving claims in California. So the left-hand panel here shows bonding claims. So these are claims to bond with a newborn or newly adopted child. And the right-hand panel shows caregiving claims, so claims to care for ill family members. So you see, many more claims for women than men. It's represented by the green versus red dashed lines here. And also just, if you look at the y-axis, sort of an order of magnitude difference in the number of claims for bonding leave compared to caregiving leave. Now, estimating take-up rates is actually quite challenging. Why? Well, we don't know the universe of people who needed leave but didn't use it, right? So ideally, in order to be able to say something about what's the take-up rate, we would use this number here as the numerator, the number of actual claims, and as a denominator, we would have something about the population of individuals that were eligible for the policy. So for bonding leave, it's a little bit easier since we know information on the number of births in California. Now, not all parents who give birth in California are going to be eligible because not all parents are working. But we have data on employment rates from other data sources, so we can do a little bit of an estimate there. So what we can get is about in 2005, right? So the first full year of the policy, about 40% of employed mothers and 5% of new fathers, employed fathers, used the program in 2005. And that went up, fairly substantially, especially in relative terms for fathers, right? So for 47% for mothers and 12% of fathers in 2014. But no, it's still less than half, even for the mothers who are actually using the policy in 2014, which is 10 years after it went into effect. It's much harder to do this calculation for caregiving claims because we just don't have good data on the universe of people who are employed and then have a family member who has a health condition that needs care. So that's just not something that's readily available. So we can't quite do this type of calculation for caregiving claims. What else can we say about it though? So in terms of the leave duration, so we can see how long people use the policy. So conditional on taking paid family leave, the vast majority, 97% of women also use SDI. So this is the temporary disability insurance. And so the average leave duration for women who have a child is about 12 weeks in California over this time period. Now for men, we see, first of all, much lower take-up rates in general, but amongst those who do conditional on taking any leave, only a quarter, right, 24%, actually take the maximum 6 weeks that they're eligible for. So the majority of men who do use the leave take less than the full amount. And then caregiving leaves also tend to be quite a bit shorter. So most women and men take less than 6 weeks of caregiving leave as well when they do use it. There's also some really interesting kind of heterogeneity patterns in terms of take up by industry and firm size. So what we did here is we plotted the distribution of different types of claims, bonding claims for men and women and caregiving claims for men and women, separately by the industry in which those workers are in, right? So for example, the top row here says about 1.4% of all women bonding claims in California came from women working in the construction industry, okay? And then what we did in order to sort of benchmark into what the actual distribution of workers who might need to use the leave looks like, we compared that to the distribution of workers in these industries in the current population survey, or the CPS, for the state of California. So when looking at bonding claim rates, we're specifically zooming in on parents of very young children to sort of get a sense of where those parents tend to be working. And when you see bold numbers here, it means that there's a statistically significant difference in the distribution of claims compared to the distribution of workers in those industries. So for example, this bold numbers here suggest that women in administrative support industry are overrepresented amongst bonding claimants. And then for firm size, we can do the similar type of calculation here. So for example, you can see here, comparing these two numbers, women in smaller firms are actually underrepresented amongst claimants. There's even more kind of inequities amongst men who use bonding claims, which is perhaps not too surprising given just there's fewer men who use the program at all. So for example, men in construction and manufacturing are substantially underrepresented amongst claimants. Men in health industry are substantially overrepresented amongst bonding claimants. And similar to the pattern for women, men in smaller firms are underrepresented. There's also a lot of sort of differences amongst caregiving claims. Basically the men who use caregiving claims look very different than the average men in the CPS data. So it's an interesting pattern in terms of industries. We can do the same thing to look at the earnings quartile of the workers as well as age group. And the bottom line here is that workers in lower earnings quartiles are underrepresented amongst claimants. So the main takeaways from this analysis are that, we do know that take up of both types of claims has increased substantially over the first decade of the program. And that's consistent with the fact that just generally awareness of the program has increased over time. But at the same time, there's still appear to be substantial barriers to using the leave. Take up among men is substantially lower than among women. As I said, the vast majority of women combine paid family leave with SDI, whereas most men don't take the maximum 6 weeks of paid leave. And access to the program is substantially unequal. So women and men in the lowest earnings quartile in the small firms are substantially underrepresented in the claims data. Some hypotheses for why we might see that is because California's policy does not provide job protection. So those workers might be the most vulnerable and therefore not able to use the policy when it doesn't have job protection. And also the wage replacement rate might be a barrier. They don't get 100% of their wages, not even close, especially during this time period. So it just might be it's too low pay in order to take the leave. Interesting patterns across industries, as I was just saying. This is just a hypothesis. We haven't done a formal analysis here, but sort of the relative family friendliness, so to speak, of the industry, or in particular the firm, might be particularly important. And then this is particularly striking for fathers who use leave, and where there might be bigger kind of stigma-related barriers to using it. Fathers who use the program are overrepresented in retail, transportation, and health, underrepresented in construction. Caregiving claimants are significantly overrepresented in the health industry. And then I have some very recent work together with two of the same co-authors and also with Jetta Stearns, where we looked at heterogeneity and take up across firms in California and found a substantial amount of heterogeneity there. So basically firms that have similar types of workers and actually pay workers similarly, have sort of similar characteristics, nevertheless have very different use rates of California's paid family leave policy. And this is consistent both for bonding claims and caregiving claims. We don't have sort of any direct evidence on what's driving this variation, but an important hypothesis and consistent with what we know from other data is it must be a story about sort of information transmission. So most workers learn about these policies through their employers. So some employers may be better or worse at transmitting this information to their workers, and also just generally firm culture and sort of peer effects. You know, if other workers are using it, then others might be more likely to use it as well. Okay. So now that sort of we have a sense of what take-up looks like, let's discuss what we know about impacts on workers' labor market outcomes. So as I started out saying, right, the goal of these policies is to help individuals balance the dual and often, as many of us know, conflicting responsibilities of family and work. Now, you know, if you sort of think about this from a theoretical perspective, it's actually ambiguous in terms of what's the impact of a family leave policy on a worker's subsequent labor market trajectories. So on the one hand, and I think this is sort of promoted as a goal by paid leave advocates, is that it's actually going to be good for workers' careers. It might increase job continuity, especially amongst new mothers, and therefore sort of improve their careers, improve their wages, improve their employment status, make them more likely to get promotions and all of these things amongst especially mothers who maybe otherwise would have quit. On the other hand, if, you know, when you have a paid leave policy, somebody's taking more time off than they otherwise would have, you know, then maybe that could actually be detrimental to their career. I would say that this concern is not particularly salient for policies in the United States where we have such short leave policies. But it is more salient in other countries, like in several countries in Europe, where you have leave policies that are more than a year in length. So if someone's staying out of the workforce for a year, 2 or 3 years, that it's not sort of, it's not unimaginable that it could have detrimental impacts on their later earnings. And then finally, there's just this general concern that because women are much more likely to use these policies. Employers know that. Employers sort of experience challenges when workers use these policies, and therefore they might be more discriminatory towards women or mothers in particular. So we'll talk a little bit more about that in just a little bit. Chris Room, Jane Waldfogel, and I looked at the impact of California's policy when it first went into effect on first leave taking and then labor market outcomes. So we found that when the policy was introduced, it nearly doubled leave taking rates amongst mothers of children under 1 year old. So if you sort of do a back of the envelope calculation on duration, on average, women in our data who were taking leave were taking about 3 weeks. And so doubled to about 6 weeks. Again, this is an average, including people who take 0. And the estimated increases were the largest for the least advantaged mothers. So those who are unmarried and racial minority groups and low education levels. And then when we looked at subsequent labor market outcomes of employed mothers, you know, 1 to 3 years later, we actually found an improvement in those that in substantial terms. Charles Baum and Chris Room did a follow-up study using a different data set. They found a higher employment rate, you know, 9 to 12 months after childbirth, and higher hours and higher wages in the child's second year of life, again, focusing on mothers. That being said, the evidence I don't think is sort of all consistent with one another. So for example, there's a very recent study by Martha Bailey and co-authors that used you know, better data than what we had access to. So they used administrative tax data, but they used a different research design. So rather than, you know, what we did and others have done as well, where we compared women in California to women in other states before and after the policy went into effect, and it's sort of what's called a difference in differences analysis. This study only had data for California, so they couldn't do that, so they couldn't compare to other states. So instead, they compared women who gave birth right after the policy went into effect. So basically in the third quarter of 2004, the policy went into effect in July 2004, to those who gave birth right before it went into effect, so in the very beginning of 2004, and relative to the difference in sort of those quarters in other years. And they actually found negative effects on these women's careers, especially looking over the longer term. So 6 to 10 years after childbirth, they observed a reduction in employment by 7%, lower annual wages by 8%, and these effects were concentrated amongst first-time mothers. The way that they explain these findings is that women who used the policy sort of liked being at home and therefore decided to maybe stay home longer or switch to part-time work or something like that. So I think it's an important piece of evidence. I do think that this effect is sort of very localized. So it's really zooming in on the population of people that used the policy right away when it went into effect, which is a very select population. We know that take-up rates, especially in the very first year of the program, were extremely low. And awareness of the program was quite low as well. So this is unlikely to be a finding that's representative for the average woman in California. But still, I think it sort of highlights that it's not clear which way this effect on labor market outcomes might go. And more generally, I think it suggests that when we talk about like women's careers, when we talk about gender equity in the labor market, paid family leave is often sort of touted as a policy that's going to solve those issues. And my view is that the evidence just doesn't suggest that it's sort of the silver bullet. We need other types of policies to solve gender inequity in the labor market. Now, what about fathers? By and large, people haven't really studied fathers' subsequent labor market outcomes. Mostly that's because there's not a whole lot of variation there. Most fathers work and it's sort of unaffected by whether they have children and whether they take leave or not. But fathers do use the leave policy when it's available. So we looked at Ann Bartel, Chris Room, Jenna Stearns, and Jane Waldfogel and I looked at fathers of children under 1 year old. And we found a pretty substantial increase of leave taking by 50% once California's policy went into effect. But because the base rate was so low, it means that leave duration on average only increased by less than 1 week. And it was interesting that when we looked at dual earner households, so households where both the father and the mother were working, we saw an increase in both joint leave taking, so fathers and mothers are on leave at the same time, as well as father-only leave taking, so fathers who take leave while the mothers return to work. Now, the US is, like I said, an outlier in not having a national policy, and other countries have had policies for quite a long time. So in Europe and Canada, we see policies in duration of 2 months up to 3.5 years with 70 to 100% of wages replaced, at least for part of that duration. There's a lot of evidence and research on these policies that I don't have the time to fully go into here. I list some citations here for some overviews, but the bottom line from all of this is that the implementation and extension of these policies does increase leave taking amongst both mothers and fathers, but the effect is typically much larger for mothers than fathers. That being said, so-called daddy months or daddy quotas, which are policies that earmark a part of the leave to father specifically. So it's a use it or lose it policy. The father has to use it. It cannot be transferred to the mother, for example, are in fact effective at increasing leave use amongst fathers. And in terms of labor market outcomes, paid leave of up to 1 year in length has either positive or mostly kind of zero effects on parent subsequent labor market outcomes. But longer leaves, so leaves that are longer than a year, are in fact detrimental to women's career outcomes. Next, let's talk a little bit about kids. So most of the research in this body of literature has focused really on maternity leave rather than, for example, paternity leave. So let me just sort of talk through that. So there's, again, this is an audience that's thinking about health policy at UCSF. I probably don't need to spend too much time talking about the possible mechanisms, but there's many, right? So potentially we could see lower maternal stress, both in the prenatal and the postnatal periods, just more time for bonding with the infant, more breastfeeding, more financial resources if otherwise the mother would have quit her job or taken unpaid leave. So, a fair amount of evidence in the literature on child outcomes. So I looked at the introduction of the FMLA, so this is unpaid leave, of course, and found that it led to improved birth outcomes and a reduction in infant mortality. But these benefits really only materialize for the most advantaged mothers. So those who are college educated and married, likely because they're much more likely to be eligible for unpaid leave under the FMLA, and also much more likely to be able to afford to use it. When studying paid maternity leave, so Jenna Stearns looked at what happened in, once TDI was required to cover paid maternity leave during the Pregnancy Discrimination Act of 1978. And she found that this led to a reduction in low birth weight and preterm births. And these benefits were much larger for Black and unmarried mothers. So this really suggests that when you have a paid leave policy, it could reduce disparities in infant health, whereas an unpaid leave policy might, if anything, exacerbate those disparities. There's also a fair amount of work showing that California leave increased breastfeeding duration, including by Rita and co-authors here, led to an improved immunization rates in terms of getting immunizations on time, for example, reduced infant hospitalizations for preventable causes, in particular hospitalizations for causes that are likely to be driven by kids being in group childcare settings at a very young age, where they're much more likely to get, severe infections and things like that, and improved potentially even behavioral outcomes at kindergarten entry. So, this evidence is important, not only as sort of like suggesting that there's benefits of paid family leave for kids, but also because we have this sort of huge body of evidence documenting that early life health and well-being has lasting consequences on long-term and even intergenerational measures of outcomes. And so as a result of that, disparities in early life health can really persist over the life cycle and across generations. And paid leave, while, like I said, may not be the silver bullet for promoting gender equity, reducing gender inequity, it might, in fact, be an important policy tool for reducing these disparities. And because it reduces disparities in early life health, it could really have some quite lasting consequences on population health and even intergenerational transmission of inequality. Now, the United States policies haven't been around long enough to really study these topics in terms of long-run outcomes, but we can learn something from other countries. So, for example, Norway introduced their paid maternity leave policy in 1977, and Carnera et al. Show that this led to improvements in children's long-run outcomes in a variety of margins, concentrated amongst kids in the most disadvantaged households. That being said, a lot of the other research from other countries looked at extensions in already generous policies. So, for example, Sweden at some point increased from like 1 year to 1 year and 3 months, and then, things like that. And these really have pretty minimal impacts on child outcomes. So, this suggests to me that really there's a lot of sort of bang for the buck when you talk about implementing a new policy that could really improve population health outcomes. But sort of extensions on the margin, when you're already going from a substantial policy to a little bit more, are unlikely to have that much of a big effect. Maternal health. So I like to use this quote from Neil Shaw from Harvard, because it really highlights, when we talk about maternal health, we often focus on the healthcare system. But it seems like paid family leave could really be important here. So in an NPR interview about the high maternal mortality rate in the United States, he said, what's important to understand is that most maternal deaths happen after women have the baby, and the fundamental failure is not unsafe medical care, but a lack of adequate social support. A lot of the risks around childbirth happen after the baby is born, during that vulnerable time, and you're trying to care for an infant while also taking care of your household and doing all the things we expect of moms. Now, with that in mind, though, surprisingly, there's been fairly limited causal evidence on the relationship between access to paid leave and maternal health, but we do know a little bit. So in particular, there's research from other countries that shows that longer leaves are associated with improved maternal health outcomes. It's hard to interpret those as causal. There's a lot of differences across these countries that have longer leaves versus shorter leaves. But researchers have looked at the introduction of the policy in Norway again, so back in 1977. So this study looked at mothers' health outcomes measured around age 40. In terms of both physical health outcomes, blood pressure, levels of pain, BMI, as well as mental health outcomes, and found substantial improvements. And now, importantly, this was around age 40. So this is sort of quite a few years after most of these women actually gave birth. So suggesting long-term impacts on maternal health outcomes associated with paid maternity leave. In the US, people have studied California's paid leave policies. So Lindsay Bullinger found improvements in maternal mental health status, And then Rita and co-authors looked at both California and New Jersey, which is actually quite novel in this literature. Almost everything is on California, but they looked at both California and New Jersey and found decreased psychological distress amongst both parents associated with these policies. And then finally, my colleague here at Stanford, Petra Persson, and I have a study that looked at Sweden, and we were interested in understanding what happens when fathers use leave on mothers' health outcomes. And we found that a policy that basically enabled fathers to be able to more flexibly use leave at the very beginning of a child's life had improvements for maternal mental and physical health outcomes. So when dads can stay home because they have access to flexible leave, this leads to improved maternal postpartum health, basically in the few months following childbirth. So the last little bit of evidence that I want to discuss here is regarding employers. So as I mentioned earlier, the vast majority of paid leave programs and all the paid leave programs in the US are financed either mostly or entirely through employee payroll taxes. So there's really not very many direct costs to employers, meaning employers are not paying for this leave themselves. But of course, there may well be all kinds of other costs associated with having workers use paid family leave. You know, employers have to figure out a way to cover the work. They might need to hire replacement workers. They might need to sort of coordinate the schedules of their other employees. And so, you know, not surprisingly, perhaps the strongest opponents to paid family leave in the United States tend to be various business advocates. So the Chamber of Commerce, the National Federation of Independent Business, and various business community leaders. Right, so that's sort of the common argument. And when people ask me, like, why is the US the only country that doesn't have a paid family leave policy at the federal level, or one of two, basically, you know, one of the answers is, well, there's this sort of general sense that this is going to be really bad for small business. And so political advocates for business interests tend to be opposed to this policy. So despite that kind of general rhetoric, you know, it's not really clear a priori that that's the case, right? So it may actually be beneficial to employers, right? If workers are more likely to stay with an employer when they have access to paid family leave, maybe we should see a reduction in turnover rates and just a general improved employee morale, greater productivity. So up until now, and really still today, there's actually very limited evidence on employers. So Eileen Applebaum and Ruth Milkman conducted kind of seminal surveys, and they later published a book on this topic, where they surveyed about 250 California firms in 2010. Now, one sort of drawback of the survey, you know, despite this being really important work and really the first of its kind, is that they didn't have any pre-period data. So they only surveyed firms in 2010 after the policy already went into effect in California. That being said, about 90% of their firms reported that California's policy had either a positive or zero effect on employee productivity, morale, and costs. And they also asked them how they dealt with leaves, and about 2/3 of the firms temporarily reassign the work to others, while the remainder hire temporary replacements. So then Ann Bartel, Chris Room, Meredith Slopin, and Jane Folkvogel and I were really interested in trying to get more evidence on employers. So what we did is we looked at New York. So New York's policy went into effect in 2018. And we went in and surveyed employers, and we focused on small employers, so those with less than 100 employees. And we surveyed them before the policy went into effect. So we went in 2016 and 17 and surveyed them in the 2 years before the policy went into effect. And then we were actually able to survey them in 2018 and 2019 as well, so the 2 years after. And we also surveyed employers in Pennsylvania and actually New Jersey as well. So Pennsylvania in this case served as our control state because it did not have any paid family leave policy during this entire time period. So we essentially compared what happened to employer outcomes after New York's policy went into effect, from before to after the policy, relative to any changes in outcomes in Pennsylvania, to sort of just account for any other kind of trends that are happening over this time period. And we find, sort of contrary to expectations of these policies have big costs for employers, when we surveyed employers about, you know, how they're doing, how their employees are doing, we found zero evidence of adverse impacts on employers' ratings of employee performance in terms of their attendance, commitment, cooperation, productivity, and teamwork. And they actually reported a substantial improvement. We observed a substantial improvement in employers' ease of handling lengthy employee absences, concentrate in the first policy year. And we also saw a large increase in the incidence of employee leave taking, driven by the smallest employers who previously didn't have access to the Federal Family and Medical Leave Act. We think that this improvement in the ease of handling lengthy absences is consistent with sort of some qualitative evidence that we've heard from employers. You know, pretty much all employers have to deal with their employees needing to take some time off, you know, in the event of childbirth or having a family member who needs some care. And prior to these policies, they had to deal with this on a case-by-case basis, sort of cobbling together whatever, you know, benefits they have to figure out what to do for their workers. When you have a state policy, it's actually easier to do it, right? You just refer everybody to the state policy. It's sort of standardized. It no longer is no longer a burden to the employer to actually have to figure out how to deal with these types of absences. And the other sort of interesting thing is, so we were able to continue our survey during COVID. So on the one hand, COVID was unfortunate. Well, COVID was unfortunate for many reasons, but for our survey, it was unfortunate because it kind of messed up our research design of New York, right? Like COVID changed everything, so we couldn't really use the COVID period to look at the effect of New York's policy. However, it also gave us an opportunity to sort of try to understand what happened during COVID. And one of the things that we were able to look at is what happened to employers' ratings of support or opposition towards their state paid family leave policy. And we did this both in New York and in New Jersey. New Jersey also has a policy that's been in effect since 2009. And we found that there's been a fairly large increase. So first of all, there was pretty high support for these policies before COVID, and it increased during COVID. And it increased in particular amongst employers who had a worker use the state level policy or the federal emergency policy that existed during COVID, but has now been discontinued. So it seems like once employers saw that, you know, workers used the policy and it was all kind of okay and it didn't destroy them, they are actually even more supportive of the policy. And just to be clear, we looked at, you know, of course, a lot of employers went out of business during COVID, but we looked at a sample of employers who were there in both waves of our survey. So they were there in 2019 before COVID, and then they continued to be there in 2020, in the fall of 2020 during COVID as well. And then finally, as I mentioned, I wanted to just briefly preview a little bit of ongoing work that I have joint with Courtney Coyle and Amanda Sue, who's a PhD student here at Stanford. So pretty much all the research that I've been talking about has really been focused on parental leave. We know quite a bit about what happens to new mothers in terms of their labor market outcomes. We know about kids during infancy and so on. But as I said, like a big part of this policy is caregiving leave to care for family members with health shocks or with health conditions. And we don't know a whole lot about that. So this new work is trying to say something about that. So we're using data from the Medical Expenditure Panel Survey, and we're going to try to look at all the states that we can during our sample period. So this would be California, New Jersey, and New York that introduced policies. Rhode Island is just too small, unfortunately, for us to study. The MAPS data is really nice because we can actually observe various types of health shocks for family members. So we can observe, for example, hospitalizations for various causes, ER visits, and surgeries and things like that. And we can look at both individuals whose spouses experience a health shock as well as individuals whose children experience a health shock. And we can follow people over time. And so we can look at what happens to, for example, their various employment outcomes, but also their mental health outcomes. And we can measure mental health through a variety of ways, both in terms of self-reported mental health, as well as the use of any kind of prescription medication for mental health conditions. So again, this work is very much ongoing, so I don't have any exciting results to really share with you. Preliminary results do indicate that we see an improvement in mental health of the respondents. So I guess a health shock leads to a deterioration in mental health, and paid family leave helps to buffer against that deterioration. That's kind of the finding that we're seeing. We're not seeing a whole lot of action on the labor market outcomes. It really seems to be concentrated amongst mental well-being. Okay, so now that I'm almost at time here, let me just sort of briefly conclude and leave you with some kind of thoughts that I have on future directions for where research should be headed. So, the research indicates that paid family leave policy increases leave taking as well as leave duration amongst both mothers and fathers. The effects are larger for the least advantaged populations when policies go into effect. That being said, there's still large disparities in use. But we do think that paid leave has the potential to reduce inequalities in leave access, which is in contrast to what we know from unpaid leave. The evidence on paid leave and maternal labor market outcomes is mixed. As I've said, paid leave is not a silver bullet for solving gender equity issues, but we do have fairly strong evidence that paid family leave improves infant and maternal health. The structure of the program and whether the father can stay home as well, I think matters quite a bit. And the benefits of paid leave to employees and their families seem to come at little or no cost to employers. And in fact, most employers are supportive of paid family leave and potentially more so during the pandemic. Now, despite the sort of huge body of research on paid family leave, I think there's more to do. And so here's just some thoughts that I have on where we need more. So as I said, sort of the impacts of paid leave on families with health shocks unrelated to childbirth, we really don't know a whole lot there. So we have this ongoing work that's trying to address that. Other employer outcomes, I do think we need more on employers. So just our studies kind of not enough. And then the other thing is that there's just so much variation across states and all these different policy parameters. How big is the wage replacement rate? How progressive is the wage replacement rate? The duration of the leave, whether or not there's job protection. We need to understand this better. We need to understand how important are each of these individual policy parameters in terms of determining these various outcomes. This is really hard to do because it's really hard to separate out the effect of any particular policy parameter from the overall policy. But I think sort of really important work that needs to be done. And then finally, we know pretty little on the impacts of leave that's taken for an own temporary illness or disabilities. There's a big literature on SSDI programs. So these are long-term disabilities. So when people exit the labor force, so we know quite a bit about that, but we really don't know a whole lot about temporary illnesses and temporary disabilities, which a lot of the current paid family and medical leave policies are really trying to target and help. So I think more research needs to be done there. And that's all I have. And I'm very happy to answer any questions that people might have.
Great, thank you for that amazing talk. Yeah, I didn't mention at the outset, but I think your COVID slides made clear that this is a conversation that's really active right now in the policymaking world. And evidence like this really has the potential to speak to ongoing policymaking. I want to remind everybody to put questions in the chat box for us to get to, or in the Q&A box, and I'm going to take the moderator prerogative and ask the first question, and by the time some trickle in. So my question is, can you speak a bit to whether paid family leave policies differ for same-sex couples? Does this affect eligibility for either FMLA or the various employer and state policies that are available? And I know it's probably hard to study because it's like a smaller subgroup of the population, but is there any research on whether take-up or health effects differ for this group?
Yeah, thank you for raising that. It's a really important question. And I think precisely as you said, there's unfortunately not so much research on exactly that population. In terms of the eligibility, as far as I know, the eligibility is the same. So both parents are eligible for paid family medical leave after the birth of a child. And I guess there's a distinction between the birthing parent and the non-birthing parent, if that is the case. But if the family adopts a child, they're also eligible for paid family leave. So in terms of eligibility, as far as I know, there's no differences there. But in terms of the potentially different effects on outcomes for this population, yeah, as far as I know, we don't really know a whole lot about that, unfortunately. I mean, what we do know a little bit more from other countries. So one thing so you may be familiar with this term, or at least in econ, we have this term called the child penalty, which I think is a terrible term, but anyway, but it's the idea that we see this huge earnings gap emerge between men and women after childbirth. And so women just have lower and very persistent earnings. It's been documented in many countries. One of the sort of interesting findings that's emerged from that literature is that when you look at same-sex couples, you don't see that. So you don't see sort of a disparate effect on earnings for the birthing and the non-birthing parent, for example. So it may well be that the impacts of paid family leave are different for those families, but we just don't know a whole lot about that.
Great, thank you. We have one question in the chat from Shueshi Wang. I'm wondering whether there are data sets that contain both labor market outcomes and health outcomes.
Yeah, that's a good question. And so, yeah, so if you look in other countries, like in Scandinavia, the answer is yes. Like you could like link population level data on all kinds of outcomes, and pretty awesome. And so there's a lot of research that happens in those countries. In the US, that's much harder. But the MEPS, so the data set that I was mentioning, the Medical Expenditure Panel Survey, is one that's kind of okay on this. So they have information, pretty detailed information, as you might imagine, on medical expenditures, as well as various sort of contacts with the healthcare system, and self-reported health. And then also has information on employment status and earnings. That being said, like my understanding is that the labor market data is kind of worse quality than the health data in that data set. But it's there. Also, the National Health Interviews Survey is another survey data set that has a lot of information on health and has sort of basic information on employment outcomes as well.
Great, thank you. Another question from Justin White, one of the co-authors on my papers there that you saw. He says, great talk. You mentioned heterogeneity and leave taking across firms, in part due to workplace culture and management. Do you have thoughts on how to shift workplace social norms to promote take-up?
Yeah, big question. It's such an important one. I do think that that's such a big driving force for the inequality that we see in leave use. And honestly, like unlike, you know, policy, I mean, policies are hard to change, but we sort of know the general process for how that works. Culture, I think, is even harder to change. We can learn a little bit again from other countries. So for example, there are studies showing that peer effects and leave use matter a lot. So men whose coworkers, male coworkers or brothers use leave are much more likely to use leave themselves. So that to me suggests that sort of having a firm in which especially men are using the leave policy is going to have this kind of snowball effect, especially if that is happening sort of at higher ranks of management and so on, where you're really shifting the culture and sort of saying like it's okay to do this and so on.
Like the Pete Buttigieg effect when he took, I think, paternity leave last year, recently. Yeah, we'll see whether there's like a spike there in the data. Let's see. I have a question, and then after that, maybe we can see if there's one more after that. So I had a question. Maybe this is getting a little bit specific about the 2019 Bailey study you showed. That was the one for folks in the audience that was looking at right before the California policy went into effect, comparing people in like the first and third or fourth quarters, right? And I was wondering if they were able to account for seasonality in births across the year, just because I have this.
Yeah, so they did. I mean, so what they did is they sort of compared the 2004 difference to the difference in other years, right? So in 2005, 2006, 2003. So they did. So I think it's not sort of as much of an issue of not accounting of seasonality, but just I think it's sort of a very localized effect, right?
Yeah. Okay, great. And then, there's another response to the earlier question about data set availability. This is from Ed Yellen, who directs, I think, the California Labor Lab at UCSF. And he says they'll be sponsoring a large California random sample survey with respondents followed for 4 years, in which health and employment outcomes will both be measured serially. Awesome.
Good to know. Hi, Ed. I actually know Ed personally, so it's nice to see you there.
Yes. If only we could all see each other in person soon, I hope. And actually, on that note, I think we can pause then or sort of end the Q&A. Thank you again so much, Dr. Rossen-Slater, for your amazing and really timely presentation. As a reminder to everyone, next month we will not be holding grand rounds, and we're going to be hosting Dr. Sandro Galea from Boston University for the Chancellor's Health Policy Lecture. And that's another event that I'm also very excited about since he's a really terrific speaker. And that one is going to be May 3rd from 4 to 5 p.m. at Genentech Hall. So that one will be in person, but also with a remote option available. And his talk is entitled Rethinking Our Approach to Health After a Pandemic, Lessons Learned from COVID-19. If you want to see more details, you can check out the events section of the website, healthpolicy.ucsf.edu. So thank you again, Dr. Rossen-Slater, and thanks to everyone for attending. And I hope we'll see everybody at an upcoming event.
Thank you, everybody.